Welcome to our exploration of implementation science in public health. Implementation science is the study of methods to integrate evidence based interventions into real world settings. Implementation science addresses the gap between research findings and their practical application. Many effective interventions never reach the people who need them most. Implementation science guides the evidence based practice cycle, providing methods to effectively translate research findings into clinical practice. The ultimate goal of implementation science is to improve health outcomes for everyone by ensuring faster implementation, broader reach, and sustainable change in healthcare practices. Implementation science transforms how we deliver healthcare, ensuring research benefits reach all communities, particularly those most vulnerable or underserved. Let's explore the evidence to practice gap. Imagine a research paper filled with groundbreaking discoveries. Now picture a busy clinic where healthcare is delivered. The evidence to practice gap is the space between these two worlds. It represents the challenge of getting those research findings into everyday practice where they can help people. Many barriers exist on both sides of this gap. In the research world, barriers include complex study designs, statistical jargon, limited practical guidance, and paywalled publications. In the practice world, professionals face time constraints, resource limitations, organizational policies, and resistance to change. One framework for understanding this gap examines how knowledge influences attitudes, which then influence behavior. Even when healthcare providers have access to evidence, multiple factors affect whether that knowledge changes practice. Implementation science emerged specifically to address this gap. It provides systematic approaches to improve the integration of evidence based interventions into real world settings. Frameworks like EPIS, exploration, preparation, implementation, and sustainment provide roadmaps for navigating this gap. These frameworks help researchers and practitioners work together to move evidence into practice through structured, systematic approaches. The goal of implementation science is to build bridges across this gap. By understanding the barriers and using structured frameworks, we can more effectively translate valuable research findings into life-improving clinical practice. Many medical and public health innovations are developed, but never effectively implemented in practice. This creates a significant gap between what we know works and what is actually being used in healthcare settings. Implementation science bridges the gap between research discoveries and their